My name is Caitlin Caplet. This is Brian Smith. Brian, do you give consent for NU 650 physical assessment?
Yes.
I'm washing my hands. The head has no lumps, deformities, contour is regular, face is symmetrical, expression is normal, skin is pink, no signs of cyanosis, eyebrows are symmetrical as well as eyelids with no drooping. The conjunctivae, sclera, good, are all with normal coloration, no drainage or exudate noted. Now going to look at your pupils. They are threes and round. Good. And reactive to direct and consensual. Now going to test for accommodation. Follow my pen light. Perfect. Now going to test extraocular movements. I want you to follow my pen light again. Perfect. Now cover one eye for me. I want you to tell me when you see my finger moving.
Yep. Yep.
Good. Cover the other eye.
Yep. Yep.
Good. Free of any nystagmus or lid lag. I'm now going to use the ophthalmoscope to assess the internal structures of the eyes. I am locating the red reflex and moving in slowly. I now have the yellow-orange optic disc within vision. And I am dialing in to focus in. Good, look at the light for me. Now examining the fovea, macula, and retina. Good, vascularity was normal, no papilledema noted. Now moving on to the ears, they are symmetrical, no lesions, deformities, lumps, any tenderness?
No.
Good, the ear canal appears to be pink. I'm going to switch to the ophthalmoscope or the otoscope. And I'm pulling his auricle upward and backwards. Good. The ear canal is pink with no lesions. I now have visualization of the eardrum, which is a pearly gray. No foreign bodies noted. Mild earwax. All right, I now want you to rub one of your ears for me. Yep, just like that. And tell me what word I am saying. Scooby-Doo.
Scooby-Doo.
Good. And I would repeat on the other side, but for time's purpose. All right, I'm now going to do the Weber test. I want you to tell me if you hear this in both ears.
Yes.
Good. I'm now going to do the Rhine test. I want you to tell me when you stop hearing the vibration.
No.
Tell me when you stop hearing it.
No.
Good. Air to bone conduction is 2-to-1. I'm now moving on to the nares. They are symmetrical, no lesions, polyps, drainage. Take a deep breath in for me. Other side. No obstruction or foreign bodies. Now going to examine the internal nair. Good. Good. The mucous membrane is pink, no irritation, redness, foreign bodies, polyps, deviations noted. All right. And lips are pink, moist, intact, no cold sores, fissures. Open your mouth for me. Good. Mucous membranes are pink and moist, gums are intact, teeth are all present with no decays noted. Stick your tongue out for me. Tongue is midline. Good. The floor of the mouth looks good, free of ulcers. And relax your tongue. Open and say ah for me. Good. Tonsils are 1+. The uvula moves upward with phonation midline. I am now going to move on to your chest. I want you to lay backwards, so we're going to change to a supine 30-degree angle. Perfect. Good. I'm inspecting. JVP is about 3 centimeters above the sternum. Above the sternum, carotid pulses are visible. I'm now going to auscultate over the carotid pulse for any bruits. Good. Now I'm going to palpate one at a time. Good. Symmetrical and normal intensity. I am now palpating the chest for any fremitus, crepitus, heaves, thrills, pulsations. I'm now palpating for the PMI. Good, it's at the 5th intercostal space, mid-clavicular line. It's brisk and tapping and about 2.5 centimeters in width. Right. I'm now listening at the 5 points. So I'm starting at the aortic and then moving to pulmonary, then the Erb's point, then the tricuspid, and then the mitral or the apex. And that's in the 2nd, 3rd, 4th, and 5th intercostal spaces. Now listening with my bell. Good, no murmurs, bruits, additional heart sounds were heard, only S1 and S2, no S3 or S4. I'm now going to have you turn slightly to your left side. Perfect, just like that. I'm now listening for mitral stenosis at the 5th intercostal space, midclavicular line. This would be a diastolic murmur with the opening snap. Good, relax. I now would like you to sit upward for me and lean slightly forward. Good, I'm listening at the left lower sternal border at the apex. I want you to exhale and then hold your breath out. All right, none were heard. I'm now going to palpate the radial and brachial pulses. Good, both 2+ and symmetrical. You can sit and move backwards a little bit for me with your legs straight out. Thank you. All right, I'm now inspecting the lower extremities. They are symmetrical in size, no noticeable edema, ulcers. The hair is evenly distributed, temperature is warm. I'm palpating the feet, which are both warm and symmetrical, no palpable edema. I'm now palpating, lean back for me a little bit. Palpating his femoral pulses. Good. Popliteal. Posterior tibial. And dorsalis pedis. Good. All 2+ and symmetrical. I'm now going to have you sit up and just hold your hand clenched for me. I'm now testing the patency of the radial artery here. Good. Release your hand. Good. Color returned within 3 seconds. Great. We're now going to move on to the thorax. Do you want to move forward a little bit? Perfect. I'm starting by inspecting. His respirations are a normal rate and frequency. The AP diameter is normal. There's no retractions or use of accessory muscle. I'm now going to palpate for fremitus, say 99 over and over again.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Perfect. Good. Can you turn to the side? Thank you. Perfect. I'm now going to percuss. Perfect. I am hearing resonance throughout. I am now going to percuss upward to try to find the beginning of the diaphragm for dullness. Good. And take a deep breath in for me. Good. So the diaphragmatic exertion is about 3.5 centimeters below. I now just want you to take a deep breath in and out for me. Good. Expansion is symmetrical. All right. I am now going to oscillate the breath sounds. Deep breath. Now. I'm hearing vesicular breath sounds, which are heard all through inspiration and 1/3 of expiration. Good. I now want you to say Scooby-Doo over and over again.
Scooby-Doo, 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 Scooby-Doo,
Good.
Scooby-Oo.
I now want you to say E, E, E.
E, 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 E.
Good. I now want you to whisper 1, 2, 3. Perfect. All negative. All right. We're now going to move on to your abdomen. Can you lay with your knees bent? Perfect. This would be supine 30 degrees, knees bent. Right there, upon inspection, contour is rounded, no masses, bulges, or pulsations notable. I'm now going to oscillate. Vowel sounds are audible, low gurgling intermittently with a frequency of 5 to 34 a minute. I'm now going to oscillate over the aortic, iliac, and femoral arteries for any bruise and over the liver and spleen for any venous hums or friction rub. None are noted. I'm now going to lightly palpate. Any tenderness?
No.
Now going to palpate for the aorta, which is a little bit left of the midline. Good. And it is about 2.5 centimeters in diameter. All right, I'm now going to deeply palpate. Any tenderness?
No.
Now going to use the hooking technique to palpate the liver. And take a deep breath in. Good. That's a negative Murphy sign as well. I'm now going to attempt to palpate the spleen. Turn slightly towards me. and I'm unable to palpate it. Lean back. I'm now going to percuss over all of the quadrants. Good, I'm hearing tympany throughout. I am now going to percuss for the liver edges. Good, and it is about 7 centimeters. And I'm now going to percuss in Traub's place for the spleen. And take a deep breath in. Good, tympany remains. I'm now going to have you sit up. Any CVA tenderness? Any tenderness?
No.
And lay back. Any pain?
No.
Good, McBurney's point. Any pain?
No.
Good. Lift your leg up against my hand here. Pain?
No.
Any pain?
No.
Perfect. Oh, why do I still feel?